All right, good afternoon, everybody. We're very happy today to have Jen Janes with us, who is the manager of Sweat House, which we'll talk about Sweat House this afternoon and see what types of benefits heat therapy can give to our patients here on the Breast Podcast Ever. Hi, Jen. How are you?
I'm great. How are you?
Thank you so much for joining us today. We were connected by Erica, who's a good friend of ours. But give us a little bit of background. What is Sweat House? What does a person experience when they walk into Sweat House?
Yeah, so our actually the first location in Ohio will be opening April 21st. Is going to be our first location on West Wilson Bridge Road in Worthington. So brand new to the state of Ohio. And we are a contrast therapy studio. So each suite that we have is equipped with a cold plunge tub, an infrared sauna, and then a vitamin C shower. So our members will enjoy up to 60 minutes in their suite, and they use those three modalities however they feel best accommodates them. There's no real science that says doing plunge before the heat is better or vice versa. So we just kind of help educate them the most that we can to figure out what they're trying to get out of their session and to guide them through their experience. It is, we have a lot of people that come in and will just meditate or unwind. Others like to listen to the music, watch TV, but it's kind of all their choice inside their private suite.
I love this because there are so many non-medication ways to deal with stress, to deal with improved wellness, and I think something like this is great. So you may not know, I'm a huge, huge advocate of cold therapy. So
Okay.
cold showers, cold plunge. I do it myself every morning. Yeah, an interesting anecdote. I was doing it consistently for quite a while, and then I skipped a
Hmm.
day here, here or there, as you do. And the folks that I work with at our surgery center, almost without fail, knew days that I had not done a cold shower versus days that I had done a cold shower. It always became like a joke that they could figure it out just based on my mood, based on my energy level. So there's definitely something there. But okay, let's go through all three of them. So there's cold plunge, there's
Hmm.
a heat treatment.
Yeah, so our saunas are infrared. So there is a difference between a typical like steam uh, sauna, if you will. So the infrared actually penetrates down into your surface. So it not only is great for improving muscular repair, it has the benefits of the skin health as well. So these actually penetrate to the core where a lot of others are more just kind of that superficial heat. And people find that it's easier to breathe and relax in ours because it's a steady heat rather than typical steam saunas can have varying temperatures and can be harder for people to breathe in. These are more meant for you to be able to relax and get more benefit from it.
How hot does the infrared get?
So ours, we start out the temperature at 140, but they can get as hot, and the members get to choose what temperature. So we recommend that they build up to it, but 175 is the hottest that our saunas will go.
And how long is an average session?
It really depends on the person. I honestly, the cold plunge and the saunas are kind of like, think of it like as a workout.
Mm.
Some is better than none, but then you also need to build your way up to it. So they say to build your way up to 20 minutes, but then we have people that can go longer than that as well. The more time that you spend building up, the more benefits that you get out of it.
So I'll tell you what I find when I do my cold showers. I don't do a cold plunge. I've never done a cold plunge, so I'm excited to try this. But for my
Mhm.
cold showers, no question, I have a one. I'm awake right away. As soon as
Right.
I get in the cold shower, like any sort of that drowsiness when you wake up, that goes away because it is a bit of a shock to the system.
Yes.
What I find afterwards, though, whether it's like a dopamine upregulation or I don't know what it is, I definitely have more energy in the morning, and that energy
Yes.
sort of persists for a couple of hours, which I thought is really interesting. I
Hmm.
do find I have to work my way up into it. I can't just get out of bed and get in the shower. I have to
Right.
like warm up a little bit, either do a little stretching, maybe a light workout, and then I'll make my way to the shower. It's tough to just like hop out of bed and get in the shower.
Right.
Um,
Right.
a lot of folks, when I tell them, how much value I find with the cold showers, or
Hmm.
my friends who do cold plunges, are like, I could never do that. How could you do that?
Hmm.
I could never do that. What do you say when you hear that from people?
Well, I actually recently did an event at a fitness facility in Grandview, and I brought our portable cold plunge. So that was not as regulated like the ones in the studios. In the studios, they are a constant 50-degree temperature that is regulated. This obviously being portable is a little different, but a lot of their members were the same thing. They were so nervous to get in. They're like, I can't do this. They get super nervous or excited, and I just asked them starting out to kind of set a goal for
Hmm.
themselves. And I suggested you have to go all the way in. I'm like, think when you're in a swimming pool, as you ease into it slower, it's tougher if you just kind of go all in to start. And then some people found the benefits of having somebody talk them through it.
Hmm.
Others, I would talk them through breathing on how to, because everybody gets in and will start to almost like hyperventilate a little bit at first.
Sure.
It makes it a little more painful. You need to try to breathe and relax through it. So as I was talking some of these members through, they were surprised. A lot of them would be like, I don't think I can even make this 20 seconds.
Hmm.
They'd get to a minute. Then it would be 2 minutes. Like I was kind of coaching them through it. And we had several people. It's recommended for non-athletes, if you will, 3 to 5 to build yourself up to 3 to 5 minutes. And a lot of them, once they got their breathing under control, could do that pretty easy.
Now, do you recommend breathing through your mouth, through your nose? Does that make a difference?
It's kind of what's best for you. Different breathing techniques, both when you read like the science behind even like the Wim Hof that you had mentioned
Hmm.
before
Sure.
in an email. I started looking it up. They recommend nose or mouth. It's just whatever is more your breathing style.
Yeah, Wim Hof breathing is interesting because I think he's a guy, some crazy guy in Sweden or one of these Nordic countries who is
Mhm.
all about cold plunges, and controlling your breathing. And
Right.
I got into him a bit to understand, how to control your energy level, your state, and there's a lot there. There's a lot, I think, in our physiology that these state changes, I guess you guys call them,
Uh-huh.
um, uh, can impact how we do things. But when you do a cold plunge, are you like on like your head underneath the water?
So, so our no head does not go under. It's usually kind of right up to shoulder. So I think muscular response for that, like you're trying to
Mm,
repair the muscles along with the alertness. But the other added benefit, like a lot of athletes, once they're done with their training sessions, they're put right into the cold plunge or an ice bath because it does stimulate the muscles to repair and fight that soreness that you get from overexertion. So yeah, it's recommended kind of just like up to the shoulders, not all the way under. And our tubs that are actually in the suites are almost like a chair style. So you
mm,
kind of sit in it like a chair, and it does that you can go up to kind of like mid chest up to shoulders.
right. I've noticed in my own cold showers that when I've had like an area of soreness, a tough
Hmm.
workout a couple days before, something hurts, my shoulders bothering me, the cold helps with that quite a bit. Now, one thing
Yes.
that I've played around with, and I'm interested to see how your clients have responded to this or what your own personal experience has been, is I think I want to get into something hot. So I
Hmm.
vasodilate my blood
Right.
vessels. Then I get into something cold. So I quickly vasoconstrict. And then I
Hmm.
get back into something hot and I vasodilate again. And I think
Yes.
that for me, that kind of makes sense that vasodilation with heat, vasoconstriction with cold, vasodilation again with heat. Um, what do what do people do? I know they can do a little bit of everything, but like, what are some of the patterns that you see?
Honestly, from studios that are open and like the outreach that we've done there, it really kind of depends on the person's time. So we offer 30 or 60-minute sessions. When they first opened, the creator Jamie was like it was straight up 60, but then they were finding that people don't always have that amount of time.
Hmm.
So we have some people that will do the unlimited memberships and come in and just cold plunge and then leave. Other
Mm,
days they may come in and just do sauna and leave. And then we have people that do what you are talking about. They will hop back and forth
yeah.
sometimes between the cold to hot or vice versa. Or we have, it's a little bit of everything just because there's no true science that tells you how you should do it. Um, so people kind of experiment with that. But we do have people that, will then cold, then hot, and then they're done. So always finish off with the vitamin C shower. Is important that it gets overlooked a lot because people just think the cold and hot therapy, but the benefits of our vitamin C shower that is done last is great for the hair, skin, nails, that kind of stuff as
I
well.
definitely want to get to the vitamin C shower because I'm curious about that.
Hmm.
But when I think about this for our patients, we have a lot of patients who have, let's say, inflammation from breast implants.
Hmm.
And I think that cold therapy, I would imagine, would be helpful for that because cold in general is very anti-inflammatory. It's why athletes use it. It's sort of
Hmm.
systemic at your body. So it's something that I've never really talked to patients about, but it is, I think it would be interesting to have folks with these inflammatory
Hmm.
conditions try the cold therapy. Have you seen that with patients with, let's say, rheumatoid arthritis
Yes,
or
actually, yeah, actually, the cold and hot therapy both have the same kind of benefits.
hmm,
It does help people with arthritis a lot, the cold and the hot therapy. So even if they're doing just one or the other, even though it's doing different responses to our body, the studies have shown that even them separately do help people with the soreness, arthritis, pain management over time as well.
yeah, I think it's a really important one because cold for pain management makes a lot of sense to me. Now,
Hmm.
heat for wound healing also makes a lot of sense to me because what do you need to heal post-operatively? You need blood flow.
Right.
And what better way to increase blood flow than vasodilating in an infrared? And a lot of folks ask me when they can get in the sauna afterwards. And to be honest,
Hmm.
I'm kind of assuming that it's a steam sauna,
Hmm.
but an infrared is not steam. So it's
It is
just,
not.
and it's also a very kind of, it's more even heat
Yes.
distribution, I would think.
Yes. With like the wet or stone saunas, if you will, heat rises. So you will have varying temperatures in this or in a steam setting of the sauna, but when the infrared, it's a constant circulation, so the temperature stays the same from head to toe.
Yeah, it is something that a lot more patients talk to me about sauna, obviously, than cold therapy because cold therapy hurts, whereas a
Yes.
sauna is more comfortable. But it
Right.
is something that I'm going to start recommending to folks,
Hmm.
whether it's inflammation or healing that you're dealing with. But tell me about
Hmm.
the vitamin C shower. So what is, well, I don't know anything about that. What is that all
Yeah.
about?
And most people don't. And when I start telling females or gravitate towards it once you start talking about the benefits of it. So the infrared sauna, because it penetrates to the core, it's going to bring out the toxins in our bodies that we do from, outdoor use, the foods that we eat, all of any toxins that were entering our body. So they need to then be washed off. So the vitamin C shower is our showers are infused with like the vitamin C oil, but it also filters out all the harsh chemicals that are in water, like the chlorine, the chlorides, stuff like that. So it's actually beneficial for hair. And then your skin as well. People have mentioned that they've noticed skin tone improving. Now, if somebody's not wanting to get their hair wet, so that's an option as well. We provide shower caps, if you will, so that someone doesn't have to get that. Because I know some females are like, I can't get my hair wet. I have to go to work. But it's important to step in that shower last to rinse off everything that you have brought to the surface out of the treatments.
Okay, Jen. So yeah, we were talking about the vitamin C therapy. And back in the day, there was a guy named Linus Pauling who he was a chemist, I think, at Stanford, and he recommended these super high doses of oral vitamin C. And the guy lived till he was, super old. But the problem with that is if you take all this antioxidant, you can only like ingest so much before you just end up peeing it out. But this is really
Right.
interesting, having vitamin C as essentially like a topical treatment
Hmm.
and the antioxidant effect. So, what do people what do people see? Have you done these treatments yourself?
I have not got to experience, since we're first to Ohio, I personally have not gotten to try them yet. Now I can tell you, like, face cream that I use daily has vitamin C in it.
Sure.
Um, but what members have talked about at Open Studios is they notice a change in their skin tone with like a brighter skin, the complexion looks healthier. Same for your hair, it can kind of bring back a little bit of the shine to your hair. But just kind of obviously it's a cosmetic look, but people do notice a difference in their texture of the hair and skin.
Interesting. Um, so, how much does this cost? If we have a patient go to see you guys, What is a package cost, I guess?
Yeah, so once we open, we will have packages. But currently we are selling memberships. So we have people can come in 4 times a month for 60 minutes. We also do 30 minutes unlimited and 60 minutes unlimited. If somebody's just coming in to try a session, whether it be 30 or 60 minutes, it's $50. But the memberships get a little more, they're obviously more beneficial and affordable. So once we're open, our full pricing, so unlimited for 60 minutes is $179. A 30-minute session, I believe, is around, I'm still thinking pre-sales numbers. So we're around like 149 once we're open. And then we will see the 6 times, if you will be 129. Or sorry, the 4 times a month is 129. The package pricing we haven't got to see yet because it's not something that we're going to be able to offer until we actually open. But there will be, I believe it's like 4, 6, or 4 10 packs, type 4 or 10 packs a session. So they'll have more time to be able to use those. We've been having a lot of people that were like, well, I live in Michigan, but I come to Columbus a lot. Like I'd be interested in, being able to do this when I'm in Columbus. So that pack option we see is going to be very popular once we open, but I don't know the pricing on that yet because they have not given that to
Do you
us.
have more people doing, of the three modalities, let's call them, what do people do the
Mhm.
most?
Inside the actual suite, I have not heard. Now, based off of like time length, whether it be the 30 or 60, like I said, the 30-minute was something that was new that they introduced. People start off with 30 minutes. A lot. Right now we're sitting on, most people are going to 30 minutes, but what they're finding at the open studios is people are quickly going to the 60 minutes
Mm,
because they're finding that they're spending more time in the sauna than they thought that they would.
right. So the sauna is the most popular option.
It is because for cold plunges, like I said, medical professionals recommend about 2 to 3 times a week, 3 to 5 minutes. That's not a whole long time.
Sure.
Now, athletes, can spend more in that 10 minutes and up range. But most of us are not professional athletes needing to stay in a cold plunge that long. So
Yeah.
it's really more about how long they're wanting to stay in the sauna, or like you were talking about, doing the cycles of jumping back to forth or back and forth, because both of them do kind of mimic a workout. Your heart rate's getting up in both of those. In the saunas, it actually mimics kind of like a zone 2 workout. So people are burning calories while
Mm.
they're sitting in that sauna as well. Heart rates are rising. So.
Yeah, I'm going to look at it for our patients for particularly inflammation for the cold treatment and
Hmm.
um, wound healing for our post-operative patients. Do you see patients coming in for different conditions? I would imagine things like Sjogren's syndrome, maybe lupus, those may be things that people are being referred for.
Yeah, like I said, with us not being open, I can't speak from like personal, like seeing what we're seeing, but a lot of the people who I have talked to is like their doctors have recommended it in recovery, like from physical therapy, things like that. So people needing to help repair their muscles. Some people I've had a couple, somebody always wants to share their medical history with me, and like, I don't know you, but um, long list of ailments, if you will, and their doctors are recommending them to do sauna therapy and cold plunge. So a lot of what I can see without having members come in yet is that doctors are recommending that type of therapy to their patients.
I think there's definitely something to this state therapy, and I think it has a lot to do with what I was saying before, this constriction of your blood vessels, this dilation of your blood vessels. You can think of the dilation as getting rid of toxins. You can think of the constriction as reducing inflammation. And I think that there are real advantages to this treatment if done in like a consistent way for patients. So
Hmm.
when are you folks going to open then?
So we're having an open house tomorrow from 11 to 4, but we will be open to the public April 21st. So it'll be next Sunday, if you
And
will.
where are you located?
So we're at 71 West Wilson Bridge Road. We're Suite 155 in Worthington. So we're right across from the Kroger, right next to Club Pilates and Orange Theory.
Well, I'm looking forward to checking it out. I think it'd be kind of cool, never having done a cold plunge, to experience what that feels like. And I've always kind of wondered about the infrared sauna. So I think I'm going to check it out. So
Absolutely.
thanks for being on our little podcast, the best podcast ever here, Jen. And if you folks are interested, please do check out Sweat House. And I'm sure you'll see Jen.
All right. Yep. Come on in.